everyone, I'm Georgette Rohmer, and today I'm going to be talking about nurse practitioners and their role in the medical field. So how many of you guys are either in the medical field or going into the medical field eventually? So it looks like all of you. Very good. So currently I'm going to school for nursing, and next year I get to apply for my bachelor's program, so I'm really excited about that. It's a lot of work, but it's going to pay off in the end. It's a really rewarding career. But first I'm going to talk about a little bit about nurse practitioners versus nurses. So nurse is a general term for a medical care professional with medical responsibilities. So it's a very general term. There's 3 types of nurses. We have our LVNs and LPNs, which is our licensed vocational nurse and our licensed practical nurse. And they're going to be doing 1 year beyond high school of education. They're similar to medical assistants, so when you get to your doctor's appointment and they take you to the back, they're the ones checking your vitals, your weight. They're going to be recording medical history into their computers and sharing that with the physicians and the RNs. And they're also the ones giving your shots and injections, and they're under the supervision of a physician and an RN. And their salary annually is around $42,000 a year, and that depends on your location, what area you're working in, and it just depends on your experience. And then we also have our RNs, which is our registered nurses, and they do 2 to 4 years of education. Your 2 years is your associate's program, and your 4 year would be your bachelor's. During your 2 year, you're going to be working with mostly the biology and anatomy. You're going to be able to identify diseases using the different symptoms given, and then as you get into your bachelor's program, you're going to be working with more of the health management and leadership. And so as an RN, you're going to be assisting a lot with the medical care aspects with your patients. You're going to be working with the treatments and health prevention, and you can also specialize in different fields such as oncology, which works with more cancer patients, and then cardiology, which works with the heart, and then orthopedics, which is broken bones, hip replacements and surgeries, things like that. And so the annual salary for a nurse is around $65,000 to $68,000 annually. And it depends again on your location, what field you're specializing in, and how many years of experience you may have. And lastly, we have our nurse practitioners, which are becoming the leading health professional in the United States for many Americans. They're becoming the health partner of choice because of their clinical expertise in diagnosing and treating patients and working with health prevention, and an added emphasis on disease prevention and health management. They're the ones that work under a physician. In some states, they can work independently. They make diagnose and treat patients, and they're making around $90,000 a year annually. Again, depends on the location and the area that your expertise is in, and your years of experience. But nurse practitioners are increasingly growing, and they're solving the pending primary health crisis that we have here in the U.S. As far as for us patients, knowing the different types of nurses helps us decide who can provide us with the best quality care and services for the medical health issues that we have and that we're experiencing today and in the future. Do you have any questions? Thank you.
How many minutes?
I didn't stop it.
Oh, okay. Oh God.
I didn't touch it, but I stepped out and I made sure that I got them, and I can't get myself to the whole